most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We
therapist.
are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're going to talk about a common adolescent hip and groin pain can lead to emergency surgery. Exclamation point.
This
Must see. This is SCFE, or you call it SCFE.
SCFE. This is something that I dealt with up front. A 12-year-old girl, common hip pain.
Happened to you, right?
No, it happened a few years ago.
Oh, it did. Okay.
But I remember it clearly because I thought it was just a groin pain, just some common stretches. And she did end up going to the Mayo Clinic in Rochester for emergency surgery.
Wow.
And she's okay now.
All right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to bobandbrad.com. This week, we're always doing a giveaway. This week, we're giving away some of the Bob and Brad wall anchors. These are great for using, doing an at-home workout.
You can't go wrong with the wall anchor.
Can't. You can also find it at Facebook, Bob and Brad. It'll be pinned to the top of the page. Go to Twitter or Instagram or TikTok if you want a 60-second version of our mouths speaking a day.
There you go. So I don't want to get people all excited about your youngster who's active or maybe not active.
But showing up with groin pain.
Showing up with this hip pain that they're going to need surgery, but it can happen, and it actually has the name SCFE, which means slipped capital femoral epiphysis, which is a growth plate problem.
Yeah, it's a growth plate.
And it can be very serious if it's missed. And oftentimes this is misdiagnosed. It was in this girl's case.
She went on for months, you said.
Yeah, yep. And it was just very, I remember it distinctly. And
well, you remember it because it's such an unusual case.
Right.
And these are the ones that register in your head because.
Right. And it's easy to diagnose properly if you have X-rays.
Sure.
That's
and all you need to do.
They'll show it, and then you let the doctor, the orthopedic surgeon, carry on from there, and things will. It recovers very well.
What is the frequency, Brad? How often?
This is the good news, okay? Yeah. The good news is it's not very common. 10.8 cases per 100,000 children.
Sure.
It's not common, but when it,
uncommon.
Right. And it's like, but what happened to me with
that's kind of a little misleading statistic, Brad, because that's out of 100,000 kids. That's not out of 100,000 kids with groin pain. So I wonder how many people with groin pain at that age actually have this.
Right. Which is a good point. So you're kind of wondering, well, how do I know that this is a possibility? It's typically the symptoms are vague groin pain, or not groin pain, but hip pain, oftentimes like a pulled groin muscle.
Sure.
Very typical. That's what I thought this young girl had. So I assessed her, and I wasn't the only PT. I was the second one that worked with her. We both thought the same thing. So she was just doing general exercises. Take it easy. Don't get too aggressive. But it continued to carry on.
It kept getting worse.
Yep.
Stayed the same or worse.
Then she started to limp. That's the second very common symptom with this. So vague pain in the hip, a constant limp when they're walking. And actually with this girl, she had gym class at 12 years old, and the gym teacher was completely unaware. That was a day for the 1 mile run. So she did the 1 mile run, which was a straw that broke the camel's back, and it actually got worse. And then her parents took her to the doctor. The doctor took x-rays, immediately sent her to the orthopedic doctor, and the next day they had surgery.
Where they put a pin in it, you said.
A screw.
And then the rehab was how long?
6 to 8 weeks, no weight bearing, and then about 4 to 6 months after that.
So this is a long haul here.
So what is this? It's the hip bone right here where the ball of the hip, and the growth plate is right here. And what happens is the x-rays are quite dramatic. You'll see on a bad case, they always show the worst cases in the, when you look this stuff up, but the ball stays here and it shifts, and you can see it's no longer round. It's like it actually shifted over on the growth plate, and there's an artery that goes through the femoral head, and when that artery becomes compromised or fractured, you can actually have serious leg problems. As a matter of fact, the doctor told the parents, I don't know if this was true, maybe in extreme cases where you could lose the leg. I don't
certainly
know.
could see how you would lose the hip.
Yeah.
You need a hip replacement because you see that in adults.
Right.
Where they get a fracture of that.
Yep.
And they end up having to replace the hip.
Bo Jackson.
Bo Jackson.
Yeah.
Bo knows everything. Bo knows. I mean, he ended up having a hip replacement he was a young guy. He was still playing football and baseball, right? I mean, so.
But that's a different diagnosis.
That's a different diagnosis, but it's similar.
Similar,
in
right?
the case, there's other things. I know that common things. It could be like a tendonitis or an impingement. But even with the impingement, a lot of times you get femoral acetabular syndrome. You need to go in for X-rays on that too,
right?
Because that's how that's diagnosed.
So if your child has this and you go into the doctor to see it, just maybe we could have X-rays. Sometimes, if you ask the doctor, you say, if they have these symptoms, and the doctor say, oh, sometimes they don't always remember. It's not real common, and it's a very, the X-rays are
femoral
quite simple.
acetabular syndrome is more common.
Sure.
And I've seen 4 or 5 cases of that, Brad. I mean, before and after surgery.
Yep.
And I saw one girl this last year who came in. They didn't know what was going on. She's a cross-country runner, good runner.
Yep.
And I did the test on her. It's like, I'm sorry, but I think that's what you have. And that's what she had.
Sure.
So, again, same thing. They had to go in for X-rays. So, yeah, I think there's a lot of times people discount it because kids do get hurt. And you want to see if it's going to. I think you can wait a little bit.
Yeah.
I mean, you can wait a couple weeks.
If things aren't getting better, because they usually get better in a couple weeks, and then these symptoms arise. Another thing that they find common with this particular diagnosis, obesity. Kids that are overweight can have this. A growth spurt. If they're going through a rapid growth spurt, that's another time.
Now, your friend's daughter was not obese, though?
No, she's very active, played hockey, she played volleyball, doing all kinds of things. So
it's funny, with the girls I've seen with femoral acetabular syndrome or impingement, they were actually, every one of them was thin. And everyone is very active.
Sure.
So it's just kind of a weird... I mean, like I said, 5 cases, and they're all very, very active. But I could see how, if you were overweight, it could cause that bone to shift easier.
More stress on there.
Right.
And same with the growth spurt when things are happening so rapidly when these children are growing. So, again, you cannot get too excited about this, but it's nice to know that if these symptoms, this limping, this vague pain that's been going on, not getting better, when you see the doctor... they'll take X-rays, and if it's not that, it's good news. And if it is, it's really good news that you found out ahead of time
at the right time.
So very good.
All right.
Keep
go ahead.
Well,
what are you gonna say?
Keep your kids active and keep them moving, but just be aware.
And remember, Brad and I can fix this about anything
except for
a broken heart.
But we're working on that.
We can't fix broken hips either. So
no, but we know where to send them. Yeah.
Thanks for watching.